It's certainly not black and white always when to use a cemented or cementless stems. In my opinion, there are certainly some 6 definite prudent indications for cementless stems. That's revision surgery, conversion with prior hardware where there's a cortical defect not suited for ideal cementation, conversion with prior hardware where there's an intramedullary neocortex and sclerosis that would not permit cement interdigitation, when there's a proximal femoral deformity, necessitating decouple of version of the metaphysis and diaphysis without an osteotomy, and those femoral deformities necessitating an osteotomy, and lastly, simultaneous bilateral total hips. But I would hasten to say it is my opinion that there are 2 definite indications where it's not prudent to use cementless stems. The first is a hip fracture patient, whether you're going to do a total or a hemi. These patients, their femur's already broken and probably fractured with minimal force and effort. And in my opinion, these folks break bones for a living. And the other indication where I think it's certainly prudent to consider strongly the use of a cemented stem is in the elderly patient greater than 75 years of age, especially females that have highly poor bone quality. There are generally at high risk for fractures, and operative treatment of an early periprosthetic fracture is fraught with significant complications. 45 to 61% incident of a complication, 5 to 15% infection rate, 23% need, or 1/4% of the time will need a second reoperation, and a 1-year mortality rate of anywhere between 9 and 50%. So in conclusion, although cementless total hips is the new standard, it's my opinion it's still not the gold standard in 2025. Today, I believe a prudent approach to cementless total hips is mostly about avoiding early proximal femoral fractures or complication. Regardless, requires careful patient selection, stem selection based on femoral morphology, a humble appreciation for the data. What was thought to be prudent today will most likely not be prudent tomorrow. So again, regardless of your reasons for not routinely using cemented stems, I think there are very few good reasons for not using a cemented femoral stem in all hip fracture patients, whether they're getting a total hip or a hemi, and in all elderly patients over the age of 75 of age, especially females undergoing an elective total hip. So as Smokey the Bear used to tell us, only you can prevent these complications. Hope to see you in Houston this fall on September 11th through 13th, where we will cover all aspects of the anterior approach for primaries, complex primaries, revisions, complex deformities, and a whole host of other topics that are very relevant now. Thank you.